Hi, everybody. Welcome to Tapping Out of Trauma's biannual webinar, free webinar for everybody that has to do with EFT, tapping, trauma, and I am joined by my co-host, Suzanne Fagel,
Hi, everyone.
and a very special guest, Dr. Amy Gaesser.
Hi, everyone.
So I want to tell you a little bit about what we're going to be doing today. This interview, this webinar is about considerations for working safely and effectively with children and trauma related to children. Yeah. And we're really blessed to have Amy with us. I'm going to tell you a little bit about her. She's a friend and colleague and just so brilliant and delightful. She's an associate professor of counseling education at the College of Brockport at the State University of New York. There, she received her Ph.D. in educational psychology, counselor education, and gifted education from the University of Connecticut, and her master's in counseling education from SUNY Brockport. Her present research includes meeting the social and emotional well-being of students in school settings and interventions to reduce anxiety and address trauma for children and adolescents, including the efficacy of EFT, which is really exciting. She publishes and presents nationally, regionally, locally regarding the use of EFT for stress and anxiety management and the neurological and cognitive impacts of stress, anxiety, and trauma. So it's very appropriate that she's here with us today. She's also a mental health counselor. She has over 25 years of experience in mental health and academia. She has a private practice where she works with children of all ages and their parents. And in her practice, she uses, of course, a gentle, collaborative, client-centered approach to counseling, encouraging increased age-appropriate self-awareness, the development of skills in a safe and supportive environment, which is so important for trauma-informed care. And she's also had quite a few recent publications working with EFT, stress and anxiety management for students and staff in school settings, randomized trial comparing EFT and CBT, cognitive behavioral therapy, to reduce adolescent anxiety, working on other papers as well. So she really does a beautiful job in combining academia, counseling, private practice, research, and it's really all packaged in just really one of the sweetest, most lovely women I know. So Amy, thanks for joining us today.
Well, thank you for that wonderful introduction, Craig. I'm very excited to be joining you and Suzanne today.
Yeah, you're welcome. Suzanne, I'm going to let you go ahead and get the ball rolling today. We got a lot to cover.
Let's get started. Yes, we do have a lot to cover. This is the first time that we've actually interviewed anybody that works with this specialty of children. And so it's a huge area, obviously. And this is just we're just getting our toe in the water. But before we sort of get into some specifics, Amy, the first thing I'd really like to ask you is, what would you consider to be foundational practices and considerations for using EFT with kids? Because this is a different population than adults.
Well, that's a great question, Suzanne. Thank you for asking that. I think one of the biggest things I talk to everyone I'm working with about is the fact that when you're working with kids, you have to be comfortable first with applying EFT to yourself. So whether I'm teaching my graduate students how to use it with kids in their counseling settings or working with parents, one of the things I talk to them first about is practicing on themselves and using it for themselves. Because kids are going to pick up signals from us and from the adults around them. And so the more comfortable the adults are with it, the more comfortable and trusting the kids are in using it.
Absolutely.
I would also say never force a child to use EFT or to tap. It's so important to work at their pace. Too often we take on that kind of adult, I know best role. And it's especially important in counseling, but also when you're using EFT just in general, to make sure that the kids are comfortable with it. And so helping them become comfortable with it is part of it. So in the way you're staying child-centered. And when you're doing the tapping, when you're doing the setup phrase, when you're talking about what the issue is, using their words, not your own words. I have a great example of this. I was doing some research in schools in a Midwestern state, working with a little third grader. And she was having difficulty sleeping at night because she was having tummy aches. And so I was talking with her, and we were coming up with a setup phrase. We were going to use tummy aches as the thing we were tapping on. And then the kind of reframe of that was, I'll always have snow cone. And I thought in my head as the adult, well, if you're eating snow cones every night, of course you're going to have tummy aches, you know, and I was going on this kind of litany, but I stayed true to using the child's words. We tapped through some things. She went home. She had only had one session with us, and she went home, and the next week she came back, and mom and her both reported she was sleeping. Her stomach aches were almost all gone. And in talking with the little girl more, I realized snow cone was her stuffed teddy bear. And so keeping my mouth shut and just using the child's words was very important. You also need to just listen deeply, because too often, again, we kind of minimize what the kids are going through. And so for the child, it's very important that someone's listening and hearing them. And so again, listening deeply. I also, when I'm working with parents and kids, I ask them to post tapping diagrams around their house where they might run into them from time to time. And so often when we're dealing with stress and anxiety and trying to manage difficult situations, we go back into old habits. And so by having those tapping diagrams, and I have a variety that the kids get to pick from, by having them posted on the bathroom mirror or, you know, in the mirror in their bedroom or on their door, it helps remind them of those tapping points, because you want to minimize the anxiety of learning tapping, right? So if we have those points right in front of us, it makes it very much easier to use. And it also reminds parents, because oftentimes kids mirror what's going on for the parents. And so parents, if they are using it and modeling it, kids are more likely to step into using it and modeling it. And if its child is dealing with stress, oftentimes that accelerates the parent's stress. So it also, if the parent's tapping, it helps bring their stress down, and it makes it easier to interact with their child. I also encourage kids, especially, but parents too, to use tapping, learn the sequence at times when it's lower stress. So not wait till they're in the middle of that very stressful situation and then try and remember the stress, but maybe as they go to bed each night, doing a round of tapping, or some consistent time in the day, maybe before they get on that school bus, using that tapping to help just kind of balance them and become comfortable with that sequence.
Amy, I'm going to actually underline that, because it's the same thing that I say for adults. Right?
Yeah.
If you're going to ask people to remember to tap when they're at their most stressed, it's the least likely time they're going to remember. So practicing in less stressful times, thank you for emphasizing that and reminding people. That's really important.
Absolutely. Absolutely. The other thing it's important to understand is I found in my work with kids that they often move quicker through and resolve things more quickly. So adults are sometimes back here trying to catch up. And that's another example of myself as a practitioner. I need to be open to where the child's at, and I need to check in with the child about what's going on as much as I'm checking in with the parent, because child and parent perspectives on how things are going and how much they're using tapping are going to differ. And so, you know, whether it's parent or I work in school settings too. So talking with teachers, sometimes teachers, parents, they think, oh, they're not using it at all. And the child's telling me, oh, I use it every night. In fact, I'm teaching it to my friends. I'm teaching it to my little brother. And so listening to both parent and child is important. Another thing I think is important, and it's not just for kids, but I will remind folks related to kids, but it's important not to push to the positive, but be where the child's at. If there's a tough feeling, if there's an intense situation, don't just try and jump to, oh, we're going to tap in all those positives at the expense of not helping them clear or heal whatever the stressor or challenge is, because that's just going to cause dissidence for the child, and EFT won't be as effective. And so, and one thing I want to underscore as we're working with kids is making sure that you're not doing trauma work with a child unless you're trauma trained. And you know, that's why the work that you guys are doing with the tapping out trauma and some of the other opportunities to train in trauma work, both at a clinical level as well as just through the EFT community, are so important. I have a great example of a very well-meaning person who was a mental health practitioner who learned EFT and thought it's this amazing tool, and it is. I'm not denying that at all. You know, I'm devoting my life work to this, to EFT and getting it in schools, getting it out with kids. but she didn't understand fully what it was to do trauma work. And she was working with some young people in our community and just started to teach them EFT and tried to bring up everything so they could clear it, not realizing the importance of pacing, not realizing the importance of having containers for things. And 3 of those young people ended up in the hospital suicidal. And so you have to really be trauma trained in order to use EFT effectively and safely with young people, children, elementary, adolescent, and I would even, say adults too. That's important. So those, I know there's a very long-winded answer, Suzanne, but those are some of those.
Oh, it's really, yeah, really critical foundational pieces. Thank you, Amy.
Yeah, we could spend a whole hour just on those and take each of them deeper. And that was a really beautiful, okay, we're in it now. We're really starting to explore different things that are important to understand when working with kids, which is of course a wide demographic that we'll break down. I'd like to kind of begin on the spectrum because we're talking about like from stress to trauma, right? And one child has both, and some are more on this side of the scale and some are more on the other. Could you just talk a little bit about, and we're going to kind of get more and more specific, but just some of the stressors that children and adolescents, what do we mean by stressors? What kinds of things are they dealing with that you're seeing in clinical practice, in school settings, as you're working and teaching school counselors? Maybe you could just kind of give us an array and a perspective. Not that parents don't already know, but not everybody's a parent here. So please.
Right. So I think, there's a variety of stressors our kids are dealing with, just from normal developmental issues, growing and starting to move outside the family, starting to develop peer relationships, starting to transition into school, being away from mom and dad a little bit more, just those normal developmental transitions for adolescents, body changes, feeling changes, all those crazy things they go through as part of normal development. Those can be stressors all by themselves. But then if you add on additional layers right now that are going on in our society, things like the pandemic have brought on challenges related to being able to be with people that they care about. And so those elevated a little bit more, but are experienced as stressors. A lot of times there can be a fine line between a stressor or something that's going to become traumatic based on how parents are handling it in their environment too, which is why it's so important to be working with parents with EFT, because you want to help them to work with the kids in a way that is as less traumatic as possible, right? If they're working on their stress, then it's not being transmitted to the child quite so harshly or fully. And so you also have things like just trying to deal with the school environment, things from bullying, or just trying to balance academics with pursuing interests, right? And gaining self-confidence, those kinds of things are some of the daily stressors that our kids are dealing with. And it's important when you're working with kids, as from an adult perspective, it might not seem like a stressor, but for the child who's in the middle of it, it can be very much a stressor. For example, some of the kids I work with, have stress and anxiety around things like having to eat in school, just things that we would think of, oh, just go and do it a few times and it'll be fine. But for the child, how we approach it can either solidify that anxiety and cause it to move up from just a stressor to an anxiety, or help a child move through it more fully. And I find EFT is very effective at helping with some of those little stressors, helping to bring down that intensity so that the child can work more effectively with it. Because whether it's a stressor or it's a trauma, you're working with those same neural pathways, those same wirings, if you will. And so if we can take those little stressors and give them a tool like EFT, it doesn't accelerate or increase that cycle of that firing happening in the neural pathways that cause a stressor to move into a more of an anxiety, and then to even get higher with intensity.
Let's actually take that further then. So making that distinction from, right now, this is being recorded in the middle of pandemic, right? And there are tons of, just as an example of one of many, but stressors, are abounding, right? Whether it's masks or quarantining or being in or out of school, being in or out of participate. There's so many things, but then there's the transition to trauma. I'm
Right.
wondering if you can just kind of give us the example of things that are stressful, some of which you've already mentioned, but we can also move into social media and lots of other things that are stressors or maybe anxiety or worry producing or stress producing, but then move into traumatic experiences and take it to another level of impacting their learning, their neural pathways, their self-perceptions, et cetera.
Absolutely. So if we use the pandemic as an example, just dealing with the uncertainty of, am I going to get sick? Are my parents going to be okay? Are my family going to be okay? That starts to accelerate it into a level of anxiety. Again, it depends a lot on how the community around them and the parents deal with that. Whether it moves to a next level of higher anxiety and becoming chronic stress, moving towards trauma response. But looking at the pandemic too, having the kids come back, I see this a lot in the schools I'm working in right now. So they're transitioning back now, and kids are dealing with things like feeling like they're failures, or that they're not smart anymore because they struggled with online learning, and so there's gaps now in their education. Kids are coming back having lost family members, and schools aren't doing the greatest job. They're starting to become aware of it, but they tried to get the kids back, tried to create a sense of normalcy, which is what you want to do in the middle of an anxious and anxiety producing event. But we skipped a spot in that we aren't dealing with some of those deep feelings of fear, being back, am I going to catch things? And the loss that some of these kids have had to deal with, as well as some kids, it impacted a sense of fear around survival. Maybe they got their meals, 2 of their 3 meals a day from the school. Maybe, mom and dad weren't able to be home because they had to work. And so the child was really afraid being on their own, struggling a little bit more. There's a number of ways in which we see that transition happening right now.
Okay.
If we also, we can look at another just example is being in schools. There's the anxieties, there's stressors we've already talked about, but also some of those events around the country with school shootings create for kids a sense of trauma, a sense of worry. You also have sometimes neighborhood violence or domestic violence happening in the home that accelerate from a level of just stress at being at home to, more of a traumatic experience with being at home.
Yeah, we're also seeing a lot of issues varying from social justice to gender identity issues, and that is really making waves and being more seen, more witnessed, more understood. That can create a lot of stress moving directly to trauma as well, maybe, and especially how maybe that might be being played out in breakup challenges in social media and things that are happening. I mean, things we're looking at on TikTok. Maybe you could speak a little bit about that kind of social and social platforms and some of that some of those things that I mentioned.
Sure. So we see that, if we use social media and TikTok as examples, there's been some really disturbing challenges that have been coming that are creating a sense of lack of safety for kids in school settings because of some of the challenges to do violence at school, and kids trying to counter that or deal with that. And how am I going to be safe? So then you're layering on these challenges, whether it's hurting a teacher, whether it's doing harm at a school. You're layering that on with coming back and I'm worried about catching something because of COVID. And so there's all these different layers that start to happen, and kids become more and more hypervigilant because they're looking out for, is someone masked? Am I doing this right? I heard this thing as a rumor in school. Is there some reality to something bad that's going to happen now? And so there's all these layers of hypervigilance that we start to see forming because kids are worried and more scanning, if you will, for what might be happening in the environment, looking for cues. We see this too, if we look at media just in general. Kids, especially adolescent age and younger, are looking at climate change and what's going to happen in this world. And this sense of, the political divides, things like that. There's this renewed sense or a new sense of despair that kids haven't had to deal with before, that we're seeing a lot of, in the kids I'm working with in my practice, as well as in the school setting that we're working with.
Yeah, it's very different than, for example, Instagram self-comparison, self-image, all huge issues.
Right.
But it seems that we've now headed into survival threatening, survival feeling issues
Absolutely.
around gender, around race, around climate survival, around social justice, so many issues that have moved from stressors and anxiety producing self-esteem issues to real survival issues, which
Right.
then is of course directly related to one's experience of it being traumatic,
Absolutely.
trauma state inducing versus just, I don't want to say just stress, worry, and anxiety, but we're at a whole nother level.
Absolutely. Absolutely. If we go back to some of that normal developmental, adolescent developmental things I was talking about, like body image for girls, and you add this whole other layer with social media on of people being able to make comments, and there's not that filtering that happens when we're in person. At least there's a little bit more filtering that happens, but with social media, it's much easier to say harsh or unkind things. It's much easier to attack someone verbally and wear away even more fully at that sense of self. And then add to that some of the sites that promote how to, harm yourself, how to do things that would end the pain that you're in. All of those things can be very stress inducing, but take it to that level of trauma. And it also increases parents' level of stress because they're trying to figure out how to monitor things, how to stay on top of things. What's a normal sign of adolescent development and angst versus something that's escalated to the next level, and how do I tell, how do I differentiate and sort that out?
Yeah. Okay, folks, going to take a tapping moment here. We've talked about a heck of a lot of very stressful things, and I don't know about the rest of you out there, but I'm sort of feeling like, wow, this is quite a lot to take in.
Mm-hmm. Yeah, well, and Suzanne, thank you for doing that, because I think that's one of the things I try and stress with practitioners I'm working with is the importance of using tapping for themselves, because, it's so easy in these times of challenge to get to a point where you're becoming hypervigilant or you're kind of more intense and not able to focus as easily. And we know when that anxiety starts to rise, the thinking part of our brain shuts down. And so for practitioners, that's another tip, make sure you're tapping yourself when you're working with kids, because there's an extra poignancy of some of the challenges the kids face and how they hit us. So it's really important to keep ourselves balanced as we're working with kiddos.
Okay, so after that little break, Amy, as you were saying earlier, it seems like you can kind of almost break this down into writ large, two categories. So what would you ask the practitioner to keep in mind, especially when working with kids who are 10 years old or younger? How does one work with expressions directly or indirectly, and what can you help us understand about working with this younger population?
Absolutely. Absolutely. Well, one of the things I would say is first check your own belief systems or self-perceptions about what it is to be a child. And then try and contain that and set it aside so you can be with the child you're working with. So staying child-centered. So we look at our preconceived ideas about it, and then we set those aside and really be available and open to the child. Remember too, especially when you're working with elementary population, it's a little true with adolescents, but more so with the younger than 10 set. You're working with the parent or the adults in their environment as much as you're working with the child. And so, be aware that and engage the parent. You need buy-in from the other adults in the setting, so that when they're working with EFT, they are using it, the kid is using it as well. And there's some congruency between how we handle our stress. I also find too that sometimes you have kind of a two ends of the continuum, if you will. You have the child that's really excited about it, curious about it, and really engages easily around EFT. And then you have the child who thinks, no, this is really crazy and weird. And I would rather do something else. And so we engage in a number of different ways, and we introduce EFT in a number of different ways. And so sometimes using a stuffed animal, I was working in a kindergarten class with a teacher who had kids from a lot of high needs backgrounds, and they just couldn't stay regulated. Even for a few minutes in the classroom. And so we started doing the tapping by introducing it through a tapping bear. And once it started working, all these little ones started sliding out of their chairs and just becoming little jello puddles. So you could see very, very quickly when they were engaged around it. And within a few weeks, those little ones were reminding each other to tap. But we started to engage using the stuffed animal. When I work with kids individually, I work in a play therapy setting a lot of times. And so sometimes we talk through the characters, and we might be introducing to the characters, whether it's a puppet or a little doll we're playing with, we might engage that way. And they tell their story through the mouth of the character we're working with. And it doesn't take too long for that transition over to themselves to happen. I also have some little ones who are adamant that they don't want to do it for themselves, but they're more than happy to teach it to their siblings who need help with that. And it doesn't take long, maybe 1 or 2 sessions, and they're starting to use it more fully themselves. But looking for how to get that buy-in. Also understand some of the things we use with adults are also important to keep in mind with kiddos. So I was working with a little one who mom wasn't sure what the trauma was, but she had gotten very clear signs that there was some kind of trauma that the 9-year-old little girl was experiencing, because she went from a highly independent little one and someone who liked to spend time playing by herself and things, to not leaving mom's side, not being able to go to sleep at night without mom there, being very, very scared to go out of the house. And what we found in working with her pretty quickly was there was a little girl who had moved into the neighborhood who was placed in foster care, who had shared with this 9-year-old that I was working with some trauma, sexual trauma that had happened to her. And she shared it in great detail. And so that little one had imprinted on the little one that I was working with. And within one session, she was able to let go of that to a point where she was more independent, not needing mom there, able to sleep through the night. But we did it through a container. And the child created the container. I didn't have her talk through all the points the other little one had shared with her. We created a container, she put it in the container, and we called it that thing that the other little girl's name shared with me. And we were able to work it through. And within 3 weeks, that child no longer needed to see me. Mom was very clear and supportive about the EFT. She was reinforcing with it, and she was going at the child's pace. And, we took our cues from the little one about how much we could do with her and when we could do it. So the other thing I do with little ones is I introduce EFT through stories. And so there's some great books out there. Gorilla Thumps and Bear Hugs by Alex Ortner is a great one for, little kids 8 years and under. Jan Yordi has a couple of really good ones. Be the Boss of Your Feelings, Emotional Freedom Techniques for Children is an excellent book that teaches how to do the tapping through story. And so those are some of the different ways that we engage with the little ones. But understand that they can shift pretty quickly because they don't have, at least this is my hypothesis on it, they don't have those secondary gains attached to where they're at with their trauma or their stress. They also don't have a lot of psychological reversals going on. So it can shift pretty quickly. And, the other thing I say to kiddos is, it's a tool. And this is one of the beautiful things about EFT and working with little ones and adolescents. It's a tool that teaches them more about themselves because they're touching into their cues their body's giving them. They're learning to trust their instincts, and it's helping them to be more self-aware. When is my body giving me cues I'm stressed? Oh, I have this tool that I can use, and it's a lifelong tool that they then can apply in a variety of different areas.
So many good points there. And obviously, it demonstrates for me and continues to validate the importance of being trauma-informed and safe, to have a variety of approaches to work uniquely in a very child-centered approach, which you've spoken of so many times in your stories already. And the flexibility that's required in working with a child to adapt and not coming in with your own agenda as a practitioner, probably more than any other population, is adapting, flexible, being client-centered, child-centered, to be able to meet their needs and make them feel safe. So
Yeah,
those stories are beautiful, and thank you for some of the resources.
Absolutely. If I could just add one more thing
Yeah,
about
please do.
the
Of course.
ones that came to mind while we were talking there. You know, one of the things I found in working with, especially the youngest population, is when they start to clear things, it can become overwhelming for the parent, especially if the parent's not willing or ready yet. I shouldn't say willing, ready yet to deal with their trauma.
Right.
And I had a little boy, for example, I was working with, he had been through some physical abuse with dad. Mom and dad were no longer together, but mom was very intensely focused on this child and all of his needs at, you know, kind of, that's how she dealt with the bigger picture in life. It was all about him. And we had a very powerful, the little boy and I had a very powerful session where he put an event away in a submarine deep in the ocean, and he had all these different attachments to it. And it was a beautiful example of how powerful a container can be, and kind of putting it out there and I'm getting control over this. And he was sleeping better. He was a little bit more independent from mom. And the very next session, she canceled and pulled the child from therapy. And I tried to work with her to help her kind of use some EFT on her own and for her own things. And she just wasn't ready to go there. So it had become very unsafe feeling for her to have this little boy progress. So you need to be, as a practitioner, you need to be aware that that can happen sometimes, and have some thoughts about how you might engage with the parent, how you might encourage the parent, what resources you might be able to offer the parent, and have some referrals ready for parents if you work solely with little kids.
Do you typically work with kids under 10 on their own? Do you often start in connection with parent in the room and sometimes separate? Is that as varied as the unique situation?
Yeah, so I tend to always go with, again, at the pace of the child, so what the child wants, but inevitably we work towards the child having at least 20 minutes by themselves in the playroom with me, so that they have room to kind of express what's going on for them. And so I try and build in that independent time too. And then I also have time where I'm working with the parent within the session as well. So I try and I gauge how much time for each, the child and the parent. Sometimes it's the child and parent together, based on what the child's needs are and how they're progressing through therapy.
Great. And I'm going to progress us into adolescence. And when I ask the question, I'm also thinking of any distinctions that you might want to make, only because maybe any distinctions with private practice versus school counselors or working with a school setting as well can be different. Obviously, not necessarily a parent's there, but I was just going to ask, really, what are the unique considerations when we start to go above 10 and we start to move toward preteen and adolescence? And you know, it's a big gap from maybe 11 to 18, depending on emotional maturity. But I'd love some of your key insights into that in the different ways of applying EFT and working with this subsection.
Yeah, I think one of the most important things I find in working with the adolescents, besides not having preconceived notions, looking at what your beliefs are and setting those aside, but listening, starting with listening, not jumping into things right away, but listening. What are their concerns? What are they saying? You know, too often, especially our young people hear, oh, your ideas aren't important, or they get a cue, well, you know, that's a great idea, but you're too emotional, you're too this, you're too that. And so just listening and being there to hear what they're saying. And we might think, oh, they need to work on this or they need to work on that, but really starting where the child is and not jumping to whatever we think they need to work on, but staying with what the child says they want to work on. And not interpreting their words, not putting words in their mouth, but actually using their words. You know, I went into it. This is an example of working with kids in school settings. I was doing a study. We were using EFT and comparing it to CBT in school settings. And I went into a high school. Now, my preconceived notion as I was doing this study, we were in grades 6 through 12, was, okay, I'm going to have a lot of convincing to do of these kids because EFT looks weird. It's not the same thing as talk therapy, you know, so, you know, they probably won't want to do it. But I went into a high school, a high performing high school. Kids were in the middle of their midterms, so that definitely helped. The level of stress was high. And we started talking to them about what their concerns were and, you know, mentioned that we had this tool, and they just took to EFT really quickly. And in fact, it was a little bit hard to keep our control group isolated from using it because they went out and started teaching it to everybody. They thought it was great. They started using it on their sports teams because they felt calmer in performing. So they were teaching it to teammates. And so, you know, that was one of the preconceived things I had to set aside. But it was important that we started where they were at and what their concerns were. Be flexible with the techniques and the approaches and styles. One of the things I find more so with adolescents, but sometimes with little ones too, is they might feel a particular point is especially effective. And if they're in the middle of an exam and they get stressed, telling them they have to tap the whole sequence might not be that effective because they'll shut down. But if they have the side of the hand point, or if they have that one point that helps initially bring that level of stress down, they're more easily able to focus, and then they can incorporate the points. If we say to kids, you can only do the EFT if you remember the whole sequence and how to do it, you're going to lose some of your young people starting to use it. Where if we give them, okay, what point feels best for you, start there, and then they start to remember and incorporate the other points. So that's just an example of being flexible, okay? You know, the other thing is being able to differentiate between normal adolescent development and when is it a higher concern. It's normal sometimes, for example, for adolescents to want to isolate, not hang out with the adults as much. But, you know, if that's happening the majority of the time and they're not wanting to interact with anybody and they're starting to change their habits and things, more so, you know, a rather quick change versus a long-term change, those are some signs that we need to maybe be doing a little bit more to support that young person or investigating more what's going on. You know, if they start to give things away, you know, versus just kind of giving away old toys that they don't want anymore, but they start to give things that are important in the here and now to them away. Those are some signs that we need to be paying attention to. You know, and then really talking with the kids about what fits, what doesn't, you know, and really having them be a part of choosing. If we go back to that example of using EFT once a day, you know, at a time when it's not high stress, when is that? How would you use it? Talking it through with them, you know, what might get in the way of you using it? And inevitably, teenagers, I find, don't quite practice as much as the little ones. And sometimes if the parents are trying to engage them in it, then they absolutely don't practice as much. So saying to them, help me understand what got in the way versus, you know, why aren't you doing this? You really need to be doing this. You know, you don't know what you're missing out on because you aren't trying this great tool. You know, help me understand. Help me understand. I do something called a one down technique where I come at it, which is pretty easy with adolescents because they see a lot of adults sometimes as not knowing that much. So I come at it as, you know, I don't really understand. Help me understand. I'm missing something here, you know, and they usually respond very well to that. And we're able to find a middle ground that helps them feel more comfortable about using EFT.
I think so many of the things you're saying are so adult appropriate that when we look through this lens, that I just keep loving that all the things, so many of the things that you're saying with our youth are so appropriate with adults, but we'll just keep that a secret between us.
Yeah, exactly. Well, and you know, the other thing is too, I always have to look, I encourage my students to take a look at what are your expectations around healing, around resolving things. Because traditionally we think of, oh, trauma or significant anxiety or, you know, some diagnosis is going to be this lifelong challenge. And really what I find with kids who are using EFT and respond well to EFT is no, it does not need to take months and months and months. It can actually resolve in a few sessions. and it can resolve to the point where they're more effective and happier in their lives. So I was working with a high school girl as an example, and she was having significant stomach aches. She had agoraphobia. She couldn't hardly tolerate being in high school. She loved music. She loved performing, but the agoraphobia was progressing from middle school as she was going into high school and getting to the point where she just couldn't perform anymore either. And she couldn't handle being in the lunchroom, all of those things. We worked with her, and within 3 sessions, she was eating. She wasn't in the noise of the cafeteria because she had sensory issues. She didn't like that noise, but she was in a courtyard area eating at picnic tables with her friends. She was coming to school every day. She was re-engaging with her performing groups. And so, we need to kind of think about, what are my biases about the healing process? And can I set those aside and look at evidence of the work I'm doing with kids? So, yeah.
Great. Wow, this is such good information. Amy, what about any considerations? I know this is a whole nother huge topic with working with special populations, ADD, ADHD, autism spectrum, highly functioning, sensory processing disorder, et cetera.
Yeah. So that is a lot. And it's so important. We definitely need to be doing more research with the special populations. But we've seen mixed results with the kiddos that we've been working with. I have one little boy who was a high functioning autistic young man, brilliant. I think his IQ when we were working with him was 140. Whoa. But his anxiety was so significant that he was hitting himself in the head. He was causing a lot of verbal self-deprecation and needed a lot of one-on-one attention, to the point where they had moved him into an 8-1 classroom. So that's 8 kids, 1 teacher, 1 aide. And it didn't have the academic challenge, which just caused the more concerns and stressors related to anxiety about school not being a fun place, a safe place, all those things. We started working with him. The only social outlet that he had was a robotics club that he did as an extracurricular activity. And when he came into the study, we didn't know any of this, but he was at the point of being kicked off of the team because of the emotional outbursts he would have when he was anxious. And so we worked with him in one session and we taught him EFT. And he had a competition that weekend that he went to, and he asked mom to put a marker point on the side of the hand point, because when he was anxious, he couldn't remember things. He went pretty quickly into that high flight or fight anxiety response. And so she did that. And he also had her put the EFT tapping chart on the back of his name tag. And so the first round, the robot wasn't working very well, and she could see that he started to pace a little bit, but he was tapping. And she said he was calmer than he would normally have been, but he was pacing a little bit. The second round, the robot still wasn't working. And so she saw him step off to the side, and he was looking at the back of his name tag, and she couldn't quite tell what he was doing, but he later told us he was using the tapping points. Right before the third round, he realized after that tapping session that there was a problem with the sensors. The school gym lights were causing a sensing problem from the robot. He reprogrammed the robot. He was in charge of the third session. So he reprogrammed the robot, and it made it through almost all of the turns and tasks it needed to do. The challenging part for him, the most challenging part for him was to come, in that he was chosen to represent his team in the oral part of the competition. And he had a huge fear of speaking in front of crowds. And the question that was posed to him is, what does being on the team mean to you? And he emphasized every point he was making in his speech with the side of the hand point, but he talked about a sense of belonging, a sense of finding himself, a sense of having friends that meant something. And he wasn't kicked off the team. They made it to states. It was a great success story, but that's just a poignant example of what can happen for some kids on the autistic spectrum. For other kids, I've seen them not want to tap at all. They don't like the stimulation. So sometimes we just have, we suggest the massage. Some of those kids can't tolerate all the points, so they might just pick 1 or 2. Other kids, they just aren't comfortable with it. And so we've stepped back and we don't, encourage them to use it. We have tapping diagrams around. Mom and dads are encouraged to use it, but the child themselves aren't using it. Same thing with sensory deficit kids who don't like a lot of noise, don't like a lot of lights, don't like certain sensations on their body. Sometimes they really like the tapping because it stimulates them in a way that feels conducive to helping them calm. Other times, no, it's just too much stimulation. With the ADHD kids, again, we've seen some kids really be able to focus and concentrate more, and they start to have increased senses of self-esteem because they're being successful. For other kids, we need to add a few other tools in their tool bag. So it really depends on the child, and we do need to be doing some more studies in that area and seeing if we can sort out, effective ways to use it across the board for folks with those special populations.
It's so good, and you've covered so many of what I would consider the most important tips and ideas of working with a variety of child ages. I'm just wondering, I'm going to go to, it seems like your passion working with children has to do with seeing children become resilient, right? And
Absolutely.
developing that ability to thrive despite circumstances in their lives. So I'm just curious, with the focus on raising their resilience, so to speak, what ways do you see EFT being already successfully used or integrated effectively into different school or children's settings? And I'd like, because you've just gotten to see a lot of what many EFT practitioners are wanting to do, bringing it into schools or teaching counselors or family settings. I'm wondering if you could just speak to a little bit of how you're seeing it integrated and successes that you've seen.
Sure. So, that little, the example I shared of the kindergartners, one of the things I saw with the teacher, we worked very closely with her. She was integrating it not only when they came in for the day, so it became, hey guys, let's tap, we're getting ready to learn, we're going to focus in, we're going to settle into our chairs, but also when they lined up, because lining up was a big challenge for kids who are dysregulated. And so they used it every time they lined up to go somewhere. They used it coming back from lunch. They used it as they came back from the playground, and she used it right before they went home. And it became just an integrated part of their day. So it was not even a conscious thing sometimes when the kids would start tapping. And so that was a very smooth integration. I also worked with a teacher who was working with kids with a lot of behavioral issues, and stressing not to force the child to do it, not to shame the child if they weren't doing it, but just to kind of do it as part of a classroom tool, a classroom norm.
Right.
We found that one of the little ones that she was positive wasn't engaging with it was actually using it when he was in a quiet corner, because she had put the diagrams up and he was using it pretty regularly. And he told us, I've taken it home, I'm using it with my little brother too. And when dad gets mad, we use it in our bedrooms together. And so those are some examples. The example of the kids using it at midterm time, all of these examples though have to do with the adults becoming comfortable, and so giving the adults in the settings opportunities to experience it, and I set it up. I talk about my skepticism when I first started, because when I learned about EFT, I was a middle school counselor. I had 3 kids who were learning it from a practitioner in the community, and I noticed there was a qualitative difference. But when I heard what it was, my first response was, right, that's a nice placebo effect. But then, in working with the kids, I realized there was something qualitatively different, and I jumped into the research, and the rest is history. But allowing people to be skeptical, recognizing, yes, this is different. Would you be willing to try this with me? I love nothing better than when I'm presenting on it, to have a room say, okay, guys, we're going to try this thing. Just humor me. It's weird. And then to see their faces, you've got them when they have a response and they downregulate. Also using it with principals and trying to help the folks who are delivering the discipline in schools start to incorporate it as, when you start to work with a kid, don't even get into a conversation about what happened. Just use the tapping to help the child regulate, to help you regulate, and then have a conversation about it. So helping people see it as a regulation tool, helping, if you're in the stress response, they're not going to hear you. So the way we present it, the way we phrase it, using terminology that makes the most sense to the environments the kids are in, is a way to create it as more of a norm in the school setting. It's more accepted when you put it in language they understand. So
Yeah, that's amazing. So Amy, what's next for you? Where do you want to go with your work? My gosh.
Well, definitely getting it into more and more schools. You know, my goal is to get it as mainstream as possible in school settings, but also Craig and Elena, I'm working alongside them to develop a training workshop to work with kids in EFT. So we're putting that together. It's in the development stage now, and we hope to be rolling that out sometime over this next year. So that's something for folks to be watching for.
Yeah, I got to say the section in our EFT level 1 and 2 that's on working with children is always so long. And we were gifted the time that you got to train, and it doubled, and it felt like it could have taken the whole day. And it really, for me, was we need a lot more training for working with kids and EFT effectively, and not just like some little module within a training. So very excited. I know the depth and breadth of material that you have to offer. And I'm very excited about that. So we'll announce it when it's ready. And I just want to say, I know today could have gone all day, and we're just like dipping our toes in, but it's my hope that listeners, it sparks inspiration, ideas, making connections or realizations for themselves or for their children or for their clients. That's so important. And the reason that we do this is really, we always do this before we start our next Tapping Out of Trauma training, which for this will be starting March 4th, 2022. Still getting used to saying that. And if you'd like more information, you know, we just have tons of accolades that come from practitioners and trainers and people that are using EFT around the world. We love doing it every year. You can just check it out at tappingoutoftrauma.com. And you can also see previous webinars that we've done like this that we post there as well. So we welcome you. Let us know if you have any questions. Suzanne, thank you. And Amy, yeah, blessings and appreciation and gratitude for you being with us today.
Absolutely. And Craig, feel free to share my my email or contact information if anyone has any additional questions they'd like to touch
Well,
base.
why don't you go ahead and say which one you'd like it right here, and then we'll also post it on the page, however you'd like
Okay.
contact.
Great, great. So the probably the best one for folks to reach me at is A Gaesser. Gaesser's GAESSER at brockport.edu. That would be the best one to use for me.
Great, especially maybe practitioners that are working to advance things with school counselors or school programs that you might have some experience or insights with. Thank you so much.
Yes, thank you very much. Deep appreciation, and not only to you, but all the brave kids and school personnel and parents who are taking on this challenge and helping us all become more resilient.
Absolutely. Well, thank you for having me today, guys. It's been a true pleasure.
Yeah, our pleasure.